To all our viewers, I want to welcome you to our today's Health Talk. And let's have a look at a very interesting and sometimes referred to as an embarrassing condition. This is a condition that can embarrass one, especially if he or she is not able to understand actually what is underlying it. Now, after this video, you will then be able to appreciate why this particular condition or why certain people or some people suffer this condition. And our condition for today's presentation is called urine incontinence. In our previous clips, we took quite a good time to have a look at urine retention. And now today we want to look at the opposite of urine retention, and that is urine incontinence. So what do you understand by the word urine incontinence? So urine incontinence simply means the inability of one to control the flow of urine, what is sometimes referred to as the unintentional passing of urine. So you are not able to voluntarily control the rate or the passing of urine. That is what we call urine incontinence. In other words, the inability to control your bladder. And in most cases, urine incontinence is also referred to as lack of bladder control. Now, there are several types of urine incontinence, and for the sake of today's video, I will mention about 5 major types of urine incontinence. Now, the first one is called stress incontinence. The second type of urine incontinence is called urge incontinence. The third type is called the overflow incontinence. And the fourth one is called the functional incontinence. The last but not least is referred to as mixed incontinence. In our next video, we'll then be able to characterize each and every of those types that we have highlighted. But what are some of the possible causes of urine incontinence? Let's have a look at, in a nutshell, some of the most common causes of urine incontinence. And take this note that this list is not conclusive, but highlights the very common or most common causes. The first cause of urine incontinence is referred to as the urinary tract infection, which is simply referred to as UTI. The second cause of urine incontinence, which is also very common, is pregnancy. So pregnancy is commonly associated with urine incontinence. So whenever you experience this, then take this at the back of your mind. The next cause of urine incontinence are certain medications. So there are certain drugs that are linked to urine incontinence. For example, the groups of diuretics. Diuretics are drugs that actually results into excessive passing of urine. They result into elimination of excess fluid in the body, and that happens through the kidneys. For example, we have Lasix or even the hydrochlorothiazide. So those are just but a few examples of diuretics that can result into urine incontinence. The next cause of urine incontinence are certain beverages or drinks. For example, excessive alcohol consumption can cause urine incontinence. Drinking of coffee, or coffee if you like, can lead to urine incontinence. The next cause of urine incontinence is called chronic constipation. So constipation is the passing or what we call hardening of stool so that it's not able to pass through smoothly. So when that happens, then we have pressure being exerted to the pelvic organs, particularly the urinary tract organs. And when this happens, then one can easily develop incontinence. The next cause of urine incontinence is the injuries to the pelvic floor, damaging certain pelvic organs, and even to a larger extent can damage the bladder sphincter so that the sphincter cannot then be properly controlled to then control the flow of urine, hence leading to urine incontinence. Our next cause of urine incontinence are certain neurological diseases, for example, stroke. And when one suffers stroke, then the nerve functions are compromised. And this nerve function is what actually controls the activities of the bladder sphincters, or even the bladder muscles, even the urethral muscles, so that flow of urine can then properly be controlled. So if this happens, then one can develop urine incontinence. The next cause of urine incontinence are diseases such as diabetes mellitus. So individuals who have suffered diabetes mellitus or who have diabetes mellitus can suffer urine incontinence either coming as a result of a chronic complication referred to as the diabetic neuropathy or even the hyperglycemia itself. The next cause of urine incontinence is referred to as the menopause. So women who are going through their menopause period can present or suffer urine incontinence. So when this happens and your age bracket or your age has reached within the menopause age bracket, then you suffer urine incontinence, then you need to be properly investigated to check on your hormone levels so that we are sure that it's truly as a result of menopause. The next cause of urine incontinence is referred to as the multiple sclerosis. Of course, it may be a rare condition, but then it do occur. The next cause, and this is very common, especially in men, is referred to as the BPE. And BPE is commonly an abbreviation of what is referred to as the benign prostate enlargement. So of course an enlargement can occur as a result of either an hypertrophy or hyperplasia. So we have benign prostate hypertrophy or even the benign prostate hyperplasia. Both can result into BPE. The next cause of urine incontinence is what we call the post surgeries, particularly the surgeries of the prostate gland. So individuals who have suffered prostate cancer and have gone through the surgery, that post-surgical intervention can result into urine incontinence. Certain intra-abdominal pressures coming as a result of either one, chronic cough, laughing, excessive exercise or strenuous exercise, or even that serious sneezing can result into urine incontinence. Ladies and gentlemen, therefore, it is important for us to take note that one who suffers urine incontinence should be properly investigated to actually ascertain or confirm the exact cause of that incontinence. Just as you have seen, there are several causes of urine incontinence, and therefore to rule one out of the other, then a thorough investigation needs to be conducted. And this can only take place within a hospital system or within a health facility. And therefore, should you as an individual go through urine incontinence, or should you come across anyone going through urine incontinence, please make quick referral to the nearby health hospital for quick intervention. If you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.